Hello, I'm Tracy Belfield. Myself and Mike Miller will be your presenters today. We are both field training coordinators with the Kentucky Autism Training Center and are so glad you're with us. Today, we will be talking about working with the system, supporting students that are in school, understanding the systems and process. Again, we are so excited to share this information with you. It's really important that we know how to work together with the school system because it really does take everyone. But the systems can be complicated due to all the laws and regulations that are intertwined into the process. The biggest part of working with the school system is understanding how it all works. So that will be our overarching goal today, is to pull back the curtains a bit and help you understand the process and the systems. Mike and I are going to give you a little overview today, hopefully without getting too far into the weeds. Our objectives today are that you'll know how to make a child find referral. You'll know the difference between a medical diagnosis and an educational eligibility. You'll be familiar with the main components of an individual education program, better known as an IEP, and to help familiarize yourself with some of the evidence-based practices and interventions that may be used. Before we get started, we need to talk about the secret code that most special education staff speak in. It's the world of acronyms. On this slide, we have listed many of the common ones used and written out what they stand for. But please, when you are discussing anything with someone and they begin using acronyms that you don't understand, do not be afraid to stop them and ask them what it means and what it stands for. I promise they're not doing it on purpose. It really is just their everyday language in the world of special education. And sometimes they forget that others do not always speak the same language. We provided some more examples in your resource documents that we will share at the end of this presentation. So let's get started on these. The first is the ARC, known as the Admission and Release Committee. The ARC is a team of individuals that makes educational decisions for a child who may need special education services or who has already been placed in services. It includes the parent, the child as appropriate, a regular education teacher, a special education teacher, a district representative. This might be the principal, director of special education, guidance counselor, or some other appointed individual. Any evaluators and related service providers as needed. Sometimes the ARC is also referred to as the IEP team. It really is all the same thing. Next on our list is BIP, often called a BIP, which is a behavior intervention plan. This is a plan that's an additional part of the IEP or 504, and it's needed when behaviors are impacting the student's learning or that of others, and the IEP is not enough to address it. So it will further address the target behaviors in need of changing and outline the positive behavior interventions and strategies to be taught. Often before that behavior intervention plan is put in place, an FBA or a functional behavioral assessment will be done. This is a process of collecting information regarding the concerning behavior. The information collected helps determine the purpose of the function of the target behavior and helps design effective interventions. Like I said, often this comes before the behavior intervention plan is put in place. Next is our IEP, or Individualized Education Program. This is a written educational plan for a school-aged child, so starting at age 3 all the way to age 21, with disabilities developed by a team of professionals. It is a legally binding document that the team writes in order to meet the unique needs of the students identified with a disability. It guarantees that the services specified in the plan will be provided to the student. And the last one we're going to talk about is LRE, or Least Restrictive Environment. This is the educational setting that provides the student access to the general education curriculum and same-age peers to the greatest extent possible based on the child's needs. This decision is re-examined annually. On the other side of this slide are some of the other related service personnels and the acronyms used to represent them. So we have occupational therapist, the physical therapist, and the speech language pathologist. Response to intervention is something that's usually done prior to a student being placed in special education, and specially designed instruction is what the special ed teacher is going to provide for the student. Again, there's lots of acronyms that we use in the world of special education, so we've included More lists for you in our resource documents that we'll provide at the end of this presentation. So let's start at the beginning. Child find. If you are a parent, guardian, or anyone suspects that a child has a disability and they are not receiving special education services, as long as they are between the ages of 3 to 21, you can make a referral. In order to receive special education services, they have to have an identified disability and a need for that specially designed instruction to make progress in school. Again, I just mentioned specially designed instruction, or SDI, which means the general education content, materials, and methods of teaching are designed to meet the student's unique needs. It will be something different that the student needs. So, in order to make a referral, you need to let the school know that you think the student has a disability and should be evaluated. Again, remember, any individual can make this request. It is best for this referral to be done in writing so that there is documentation of the request, but it can be done over the phone, in person, or whatever other means you feel comfortable again. Like I said, anyone can make this referral. It could be teachers, parents, community members. Once they have that referral and it's been made, the school staff will have to invite the parent or guardian to a meeting to discuss the referral and decide the next steps. So let's talk just a moment about that educational representative. This is the parent or guardian that will help make decisions for the student and be invited to the ARC meetings. So if a child is placed with foster parents, the ARC member has to determine if parental rights have been terminated. I'm going to be very honest with you. In all the cases that I have been involved with, this rarely happens. Parents' educational rights are one of the very last rights that they lose. And so often the parents still have educational rights. So if the parents' rights have not been terminated, the ARC chairperson will follow procedures for inviting the biological, adoptive, or legal guardian. And this includes if they're incarcerated, if they live in another state. And again, attempts will be made to contact both biological parents or adoptive parents, whatever the situation may be. Now, the foster parent may attend the ARC meeting to gain further information of how best to support the student while they're in their care, but they're not necessarily an active member of that ARC meeting. In the event that the parent's rights have been terminated, the foster parent may be appointed as a surrogate, assuming certain conditions have been met, and the director of special education will make that determination or decide if some other surrogate educational representative needs to be mentioned. The child social services worker may participate in the team, but may not make any educational decisions or serve as a surrogate parent for the child when they are in the custody of the cabinet receiving special education services. So let's talk about the difference between diagnosis and eligibility. A diagnosis is made by a medical professional. For the area of autism, they use the DSM, which is currently the DSM-5. So a student must meet a specified criteria to be diagnosed. For eligibility for special education services, the student must meet qualifications as outlined in the Individuals with Disability Education Act, as well as the Kentucky Administrative Regulations. There must also be evidence that the condition is negatively impacting the student's learning or educational performance. These decisions are made by the multidisciplinary team, or ARC. Students who have a medical diagnosis of autism but are not determined eligible for special education services may qualify for some other services, and Mike will talk about those a little bit later. So let's kind of look at that medical model again. This is where they're using the DSM-5 for a medical diagnosis. And these are the criteria that must be met. Persistent deficits in social communication and social interaction across multiple contexts. And all three of these things must be present. Deficits in the social-emotional reciprocity, which is the individual's ability to engage in those social interactions between two or more people. Deficits in nonverbal communicative behaviors, which may include absent, reduced, or atypical use of eye contact, relative to social cultural norms, of course, gestures, facial expressions, body orientation, or speech imitation. It also must include deficits in developing, maintaining, and understanding relationships, such as difficulties adjusting behavior to suit various social contexts, difficulties in sharing imaginative play or in making friends, or an absence of interest in peers. They must also have restrictive, repetitive patterns of behavior, interest, or activities that manifest in two of these areas. A, stereotyped or repetitive behavior movements. This includes flapping and waving of arms, hand flapping, head nodding, rocking back and forth. B, an insistence of sameness and flexibility adhering to routines, ritualized patterns of verbal or nonverbal behavior. C, highly restricted or fixated interests. This could be things like watching a fan spin around for hours, flipping the flag on a toy mailbox up and down, or taking a spoon or other inanimate object everywhere they go. And then D is hyper or hyporeactive to sensory input or an unusual interest in sensory aspects of the environment. C, these symptoms must be present in early developmental periods. So again, they may have been present, but we don't really see them until later on when those learning gaps have fully manifested and there's maybe a bigger gap. But looking back, we can see those things. D, the symptoms cause clinically significant impairment in social, occupational, or other important areas of the current functioning. And E, disturbances are not better explained by an intellectual disability or global development delay. The latest DSM-5 diagnosis also gives levels, whereas previous versions of the DSM had subcategories such as Asperger's, persuasive developmental disorder not otherwise specified, also known as PDD-NOS. As a result of the DSM-5, each person is assigned a level of impairment. So level 1 is they require support, level 2 requiring substantial support, and level 3 requiring very substantial supports. So now let's take a look at special education eligibility. And we're going to look a little bit more into the Kentucky Administrative Regulations for Special Education, specifically 707. So, students have a developmental disability that significantly affects their verbal and nonverbal communication. Student has a developmental disability affecting their social interactions. Student deficits are not primarily the result of an emotional behavior disorder. An evaluation information confirms that there is an adverse effect on the educational performance. This is a really big one. Again, there needs to be an adverse effect on their educational performance. Evaluation information confirms that it wasn't due to a lack of instruction on reading and math, and that's why there's some of these gaps. And the evaluation also confirms that limited English proficiency was not a determining factor in the eligibility. Again, this is not to say that if a student has limited English proficiency that they may not qualify, but it definitely has to be looked and peeled apart a little bit more by the team. Sorry, we went one too many. All right, so as you can see, all of that can become very confusing for parents, caregivers, and those who help take care of the child, because sometimes they go, but they have a medical diagnosis. Why are they not eligible for special education services? And again, if all that criteria under special education isn't met, particularly the adverse impact, they may not be eligible. But again, there are some other services they may qualify for, and Mike will hit on those in a little bit. Or sometimes we see the reverse, where a student has not had a medical diagnosis, and yet the school is now talking about autism. Remember, that is just for the special education eligibility requirements, that they're trying to find the best category that the student may fall under. But I would definitely follow up with your doctor if that happens. Again, we've included some documents to better support that in our resource folder. So let's take a moment and go ahead and talk about related services, because again, the medical model and the school models look very different. So related services could be occupational therapy, physical therapy, speech language, pathologist therapy, and then some other uncommon ones, but they are related services, vision impairment, hearing impairment, and there could be others. So again, in a medical model, they're really focused on enhancing functioning at home, out in the community, and they address all the medical needs. The school model is more about promoting access to academic and school activities, and the related service providers are there to help support the attainment of the IEP goals. So it all has to be laid out in there. That is why sometimes a school model for a service may be services once a week for 20 or 30 minutes, where in a medical model they may be seeing multiple times a week. It's just the needs that they're addressing and the focus is a little bit different. School is really about how can we make them successful and give them access to the things here at school. So once that referral has been completed, and assuming it's been accepted and all ARCs and all agree upon testing and observations have been completed, the team will come back and review all the data and determine if the student is in fact eligible for services. If the student is found eligible, an IEP will be developed. As stated earlier, an IEP is a legally binding document that the team writes to meet the unique needs of the student identified with a disability. It guarantees that the services specified in the plan will be provided to the student. The IEP will be written by the ARC team to include the parents or guardian. So let's briefly talk about the contents of an IEP because again, this is a very lengthy, involved document. So first, and the cornerstone, I say this is the foundation of the IEP. And the foundation is so important, just like the foundation of your house, is the present levels, or the more full name, present levels of academic achievement and functional performance. This section should highlight the student's relative strengths, where they perform compared to same age peers, what the needs and concerns are, what the baseline data is on those needs and concerns, and how the disability adversely affects the student's involvement and progress in the general curriculum. For students with autism, at a minimum, the areas of communication and social emotional should be addressed as they are part of the student's eligibility. Next in the IEP is the consideration of special factors. IDA requires that the ARC considers 6 special factors in developing the IEP. So again, we just need to look at these 6 areas a little bit closer and make sure that we are considering them in the development of the IEP. So the areas are behavior, limited English proficiency, visual impairment, communication needs, hard of hearing, and assistive technology. If these areas were addressed within the present levels, they would have to be addressed here also. So once we have laid that foundation, it is time to move on to the measurable annual goals. The IEP includes academic and functional goals based on the needs or areas of concern identified in the present levels for the student. These need to be measurable, and the ARC must believe that the student can reasonably accomplish the goal within a year or 365 days. After those goals have been set, specially designed instruction must be determined. Again, specially designed instruction is what the teacher does to instruct, assess, or reteach the student. The specially designed instruction describes how the student adapts the content, the methodology, or delivery of instruction to address the unique needs of the students with a disability to ensure access to the general education curriculum. Next is supplementary aids and services. This is what the student needs in order to learn. SAS, or supplementary aids and services, include strategies, aids, services, and other supports provided in the general education environment or other educational settings to gain access to the general education. Accommodations, or accommodation determination. Accommodations allow students, be it on the classroom, state, or district assessment, to score what they have learned from the general curriculum. Accommodations must be related to the student's disability with evaluation data to support them and must be routinely used in the instruction within the classroom. Least restrictive environment and placement determination. Again, to the maximum extent appropriate, students with disabilities should be educated with students who are non-disabled. Special classes, separate schools, or removal from the general education environment only occurs if education in the general education environment with the use of supplementary aids and services cannot be satisfactorily achieved due to the nature and severity of the disability. Next, related services. These are the services that are necessary in order for the student to benefit from special education services as outlined in the IEP. This includes transportation and developmental, corrective, or supportive services required to assist the student. Again, as mentioned previously, these include such things as speech, OT, and PT. Extended school year services. Extended school year services are not designated or designed to teach new skills or help the student make additional progress on measurable annual goals, but only to maintain a student's present level of performance. These are services provided to a child beyond the normal school year so that they do not lose skills they've already learned when out of school for an extended period of time, such as over summer break or other extended breaks. Again, this must be data supported. And finally, secondary transition. This is thinking about life after high school. At the latest, transition will begin to be addressed within the student's IEP in 8th grade or age 14, whichever occurs first. The student should be invited to be part of the ARC in which transition services are being discussed. After all, it is their future. The transition planning process should be student-centered, student-driven, and embedded throughout the entire IEP process. Transition services are a coordinated set of activities that are updated annually. The goal is that the ARC will determine what the child needs in order to prepare him or her for successful life after high school. Please know that as you work through this, of course you can reach out to us if you have any questions, but Kentucky Spin is a great parent resource for IEP related items. Their website will be listed in the helpful website document that we're placing in the resource folder.
504 plans. If a child is being diagnosed with a disability such as autism that seems to be impacting their learning and behavior, but does not qualify for the individual education program, families and staff may want to consider a Section 504 plan. A 504 plan addresses unique learning needs of a student with a disability and provides reasonable accommodations. For example, a 504 plan may include accommodations such as extended time for tests and quizzes, movement breaks as needed, clearly established and ordered routines, warning and preparation when changes are anticipated, planning and practicing of communication strategies and social routines, earplugs or noise-canceling headsets in a hallway or lunchroom. If found eligible for a 504 plan, service plan, it should be developed. A school district must document activities and decisions made that show how appropriate educational accommodations and/or related services are being provided. The determination of what services or accommodations are needed must be made by a group of persons knowledgeable about the child. This usually involves the school principal, classroom teachers, other educators working with the child, and the parent and child should be included in the process whenever possible. The group will review the information and data used in the evaluation and eligibility determination process. Decide what accommodations or modifications are needed to meet the unique needs of the student, and allow the student with a disability to fully participate in the general education program. Most school districts develop written plans for their students with disabilities in the form of a fairly simple accommodation plan or a health plan for students with health-related needs. Best practices suggest that a minimum and an accommodation plan should address the educational impact of identified disability, the necessary accommodations to access education and other school activities, how, where, and by whom the accommodations will be provided, and a monitoring system and the assignment of responsibilities for implementation. What are FBAs and BIPs? FBAs is your functional behavior assessment, and your BIP is a behavior intervention plan. Prior written consent is required before a district may conduct an FBA. When you're looking at an FBA, it is a method of gathering information regarding a child's behavior that can be used to develop positive behavioral supports in an effort to remedy the problem. An FBA is not a form of discipline. Your behavior intervention plan, after information is gathered through the functional behavior assessment, the Admissions and Release Committee uses the information to put a plan in place to help the child develop social skills and behaviors needed to be successful. With your FBA, you clearly want to define what the behavior you're looking at, determine the seriousness of the behavior, provide behavior information when and where that behavior is occurring. Is it occurring before school, during school, is it before lunch? Provides the ARC with the information to help make an educated guess as to why the behavior is occurring, the purpose of the behavior. The effective behavior intervention plan will include strategies to reduce the effects of things that trigger the behavior. You want to teach appropriate behaviors to replace the inappropriate, strategies to increase appropriate behavior, strategies to decrease inappropriate, and how to determine if the plan is working. Build and focus on strengths. We want to look at things that are strengths of the individual child, with his ability to stick to routines, see the world in a different way, can be very affectionate and loving, honest and straightforward, attend to details. It's a partnership. Parents, schools, and other partners such as mental health providers all want what is best for the students and to see them to become as independent and successful as they can. We must show respect to each other. This includes communicating frequently and following the chain of command. For example, when a contact to school, it's typically best to reach out first to the teacher first. Working together to be consistent in strategies being implemented. Evidence-based practices. This is research-based practices that we know that can work in developing skills for individuals. Here's a list of 20-something evidence-based practices. We're talking from augmentative communication systems for verbal behavior or non-speaking students, cognitive behavioral instructional strategies, direct instruction, exercise and movement, modeling, music meditated interventions. So this list of different evidence-based practices are practices that you can use to increase skills with students. Here's the big 5 evidence-based practices: antecedent-based interventions, your visual supports, communication, systematic instruction, and reinforcement. And here are some strategies for collaborating with autistic students for success. Syllabi, which gives a more direct detail of what's going to be happening in a class. Talk about very distinct instructions with assignments, structuring classes, supplemental and note-taking, record audio or video, mentoring and counseling, housing options if you're for higher ed, if you're at a school, housing options, testing accommodations. These are a continuous list of things that you can use as strategies for success in working with autistic students.
We hope you have enjoyed the information that we have shared and that it will be beneficial for you. As always, you can go to kyautism.org to visit our website at Kentucky Autism Training Center. You may also join our listserv. We'd love to have you friend us on Facebook or join us on Twitter. We also have lots of videos to further explain other topics on YouTube. To access our resource folder, simply scan the QR code. If you have any additional questions, feel free to email Mike or myself at the emails listed on the screen. Before you leave, we would really appreciate you taking a moment and filling out the simple evaluation. Please give us honest feedback. Again, we appreciate your time and hope that it has been an enjoyable experience.